All right, everybody. Welcome to the AI in Patient Care and AI in Health Operations Finalist Spotlight session of the 7th Annual Digital Health Awards. I'm thrilled to be joined by Mark Goldstein, our executive producer, CEO at Great Gums, and partner at Builders VC. Today, you'll hear directly from standout finalists in this important category, companies shaping the future of healthcare across the globe. I'm Bethany Boschert, the show director of the Digital Health Awards, and I'm excited to welcome you. This is my 4th year with the Digital Health Hub Foundation, and it has been amazing to watch how quickly the digital health space continues to evolve, especially in areas like AI. At the Digital Health Hub, we are here to celebrate the innovators shaping the future of healthcare. Thank you for joining us today. I just want to take a quick moment to introduce the Digital Health Hub Foundation, the 501c3 nonprofit behind today's session and the annual Digital Health Awards. We were founded in 2017 at UCSF with a mission to help the world's best digital health startups grow, scale, and succeed. Today, our community includes over 30,000 innovators, from early stage founders to industry leaders, investors, payers, and providers. Throughout the year, we run educational programming, network events, and thought leadership series, all leading to the biggest moment, the Digital Health Awards in Health in Las Vegas, where we celebrate the companies truly transforming healthcare. We're proud to shine a light on this ecosystem and grateful to all of you for being part of it. I'd like to introduce Jason Saltzman, Head of Insights at CB Insights. Jason, all yours.
Hi, how you doing, everyone? I'm Jason. I'm the head of insights at CB Insights. We're the predictive intelligence partner for health in Vegas this year, and excited to be here to wave my hand and say AI, and really just set the stage for what you all will present on and some of the finalists for the AI in healthcare operations and patient care. Um, if, just to give a little bit more context on CV Insights, we're a predictive intelligence on private companies platform. We help everyone from, corporate strategy, corporate venture, business development teams understand the companies and technologies that are defining the future, especially in healthcare. When we go to the next slide and take a look at what AI in healthcare and sort of in operations and patient care looks like, right? We see that funding is sort of at an all-time, right? I guess if you take the last 5 years of funding into AI in healthcare companies, right, we've gotten to the point where it's, well, approaching almost $40 billion, which is, dramatically higher than any time previously. And we start to take a look at, the dominance of healthcare AI companies in the new unicorn creation, right? Almost half of the new AI unicorns in the first half of 2025 were healthcare companies, and healthcare is currently one of the leading sectors for applied AI growth across funding, partnerships, and acquisitions already, right? We see that, some of the areas that emerge quickly or have been emerging are clinical documentation and revenue cycle management in the healthcare ops space. And then in the patient space, or patient care space, right? We have a wide array of applications of AI, from imaging to, including brain computer interface technology, right? Really a broadly defined sector with a ton of applications for AI, many of which are seeing massive fundings as they're sort of in their infancy and sort of rolling out into commercial deployment. In terms of the predictive signals we see, right, the funding sort of speaks for itself, and we're seeing that there are a lot of sort of more comprehensive platform plays emerging, and that the FDA is starting to pave the way for a lot of actual adoption and revenue generation for the companies operating in this space. And with that, I'll hand it off to Mark.
Thank you, Jason. I want to introduce Mark. He is the founder and executive producer of the Digital Health Hub Foundation Awards, partner at Builders VC, and CEO of Great Gums. Mark, I'm going to let you take it away.
Let me rip. Great. Great Gums is actually a company I'm CEO of, and we're a finalist in dental. So I'm just throwing it out there. I don't vote for myself. Look, this is the best. This category is really. I wanted to do this category. This is obviously it's AI in healthcare. We split it into two areas, and we thought about how to best split this up. And we decided the best approach is to actually invite all of you guys together on one panel. And the reason we're doing this is we're really, when we started this foundation, it was about you guys. It was about the companies. You guys are our rock stars. You guys are what it's all about. Our judges and our sponsors, they all want to get to know our companies. We're the ones we're awarding you. And we want to make sure you guys know each other. And sort of like I know number of you are probably members of YPO, and it's really great to be able to learn from your peers. And so today, you're probably going to meet people on this webinar. We're going to reintroduce you all later. And these are probably going to be some of your best partners. And why is this? Well, we all see and we learn from each other. And look, in AI, you guys have proven you guys are the cream of the crop, the top of the heap. You know, this is New York, New York. You guys have gone through, there are 350 companies, and you guys are what's left, right? These are companies that were really the best of the best. You guys should be super proud of yourself that you've gotten this far in the finalists, and you all should know each other. You guys are the ones changing it up. And this whole idea of adjacency and partnering is really critical because we all know who the frenemy is out there. It's Epic, right? And that together, if we can basically work together, work with Epic or with around Epic and partner, we're going to be much more successful in getting to market. So look, our judges have also started voting. But this video, what's the point of what we're doing today on the webinar, is to give them a little more context and how to think and maybe how they vote. Our job is to filter all this stuff. Like, you know, when we started this process, all of you companies actually, everyone sounded alike. You know, we're all using the same types of buzzwords, the same things. We've actually started breaking it down when we ask you questions like, what is your superpower? So we're trying to make it easy for the judges to pick what are the companies, who are you guys? What are the companies making a difference and who should I vote for? Okay. So they've started to judge. This all ends up on the AI stage at HLTH, which is really great. So this year, the AI Pavilion at HLTH was by far the most popular. They've blown it out this year. We're going to give our AI awards on the AI stage, which is where all your customers and your partners are going to be. So you're going to be able to win in front of the people you want to win in front of. The question is, make it easy for the judges now. And why is what you're doing perhaps one of the most important things in healthcare, the change in healthcare, and why you should win this? And it's really, I want you to tease it down. I want you to keep it really short because remember, I'm a judge. I have to vote for all of you, and I want to remember you. So, really, with that, we're going to get this going, and I'm going to start with the top of the list. We're going to start with AI and patient care, and we're going to start with the best of class companies. Most of you are here. And those who you aren't here, well, snooze, you lose.
Yeah.
Ideometry.
Hey.
Why are you what you're doing is the most important thing. Why you should win this.
Hi, everybody. I'm Shane Cook. I'm the CEO of Ideometry. Pleasure to be here and honored to be a finalist. What we do is we focus on delivering impact in the most complex environment in healthcare. We focus on the sickest of the sick patients in the ICU with our AI-powered clinical intelligence platform, bringing together all of the information to guide and help guide clinicians make the most informed decisions possible. And what separates us really from everybody else is the number of published clinical outcomes, clinical studies showing outcomes improvements that we have at Ideometry. So we are showing substantial reductions in length of stay, reduction in time on ventilation. All of these are critical to not only patient care for the most critically ill patients, but also they affect the caregivers that deliver them, giving them the information needed to make the best decision possible in the moment, right at the bedside. And finally, it helps the hospitals and the health systems reduce their cost. So we are focused on making the biggest impact where it is needed the most in the healthcare industry.
Right at the ICU. I love it. Okay, great. Thanks, Shane. Fluid AI, you're next. Talk about what you're doing with post-surgical procedures and whatnot.
Hi, everyone. Abdullah, co-founder and CTO at Fluid AI. So in a nutshell, what we do is we bring data-driven solutions to post-operative care and peri-op care. What that means is if you're a patient going into surgery, there's a whole pathway that you're going to follow before surgery, preparation, education, etc. You do the surgery itself, where that's where most people focus. And then there's a whole journey that comes up afterwards, oftentimes with resurgery and physiotherapy and everything that happens there. So what we do is we use data to drive better outcomes by integrating, first by taking that complete outlook and enabling it with AI outcomes, so predictive outcomes on what may occur during the surgery, after the surgery, and allowing you to intervene a lot earlier. I think our major differentiator here is that we have a few things. Number one, we are really deep on the clinical side. We know how to engage with our clinical partners very well. We've demonstrated that with Cleveland Clinic, University Health Network, that's in Toronto, biggest one in Canada, Mayo Clinic. So we have internationally renowned health partners that really respect and appreciate what we're bringing and building into the field. Number two is that we go really deep on the data sets, and we've acquired our own proprietary data sets. We've licensed from others, but we also build our own hardware that complements these data sets and brings novel biomarkers that are ultimately predictive of these outcomes. And that's been a major differentiator, even when working with our clinical partners. And they're asking us, what's the difference between you and X, Y, or Z? We actually bring our own hardware to drive these, to generate these clinical data sets. And then from there, again, get these outcomes. So we actually just got our first, our FDA clearance about a month ago now. We're already active in Canada and internationally, and now going into the US with the FDA clearance, post Series B.
Excellent. Okay.
That's us. Thank you.
That is perfect. Okay, next up, Ferrum Health. What I like is that you guys are a platform that everyone needs to know about.
I like to hear that. I'm J.R. Randall. I am the head of strategic alliances at Ferrum Health. And Mark, you couldn't have said it better. We are the interoperable AI platform for the entirety of clinical AI for a health system. So, no surprise, AI adoption within health systems is exploding, but it's exploding, we feel, in the form of these siloed deployments that ends up forming data islands in various parts of the system. One integration with Ferrum provides a health system a gateway to over 50 FDA approved AI models, and also the ability to onboard any AI model that they create. But we also, and this is the most important thing about Ferrum, we also provide observability of the performance of those models and how those models are helping to improve downstream patient outcomes. So, impact wise, we drive AI deployment costs from a marginal deployment, the marginal cost of that deployment, typically $100,000, we drive zero. But we also deliver highly measurable patient outcomes like a 77% increase in early cancer detection that one health system was able to achieve by using Ferrum.
Nice, nice. Yeah, perfect. Well, great. So those are our four companies. Those are our best-in-class companies in AI and patient care. We're going to go now to the rising star companies, and we're going to start out with MediaWell. And I love what you guys are doing in terms of analyzing blood. Oh. Hello, MediaWell. Oh, well, snooze, you lose. Next up is Advenda Health. Advenda Health, tell us about what you're doing in the prostate cancer space.
Yeah, so I'm Sham Natarajan, co-founder and CEO of Avenda Health, and we're transforming, starting with prostate cancer care by giving oncologists and clinicians superhuman insights to reveal hidden cancer and improve treatment outcomes. This is impactful because this is a disease space that hasn't had innovation in terms of how to treat cancer in over a generation. Over 50% of patients still have cancer left behind or suffer from quality of life side effects. So we use multimodal AI. We actually integrate imaging, pathology, biomarkers, clinical information to map and reveal hidden cancer so that physicians and clinicians for the first time can actually treat it in a personalized manner. We think we should win because we've done the hard work of creating a new market. By creating strong alignment with payers, providers, and patients, we're the first AI product in urology that has not just FDA clearance, but also a new CPT code and national Medicare reimbursement. So we're transforming care for the lives of over 3 million patients in the US.
Excellent. Okay, Kevin, it's yeah, MediaWell, you come on up.
Hi, I'm founding CEO of MediWell, and our AI see your health through eye. So eye is the only organ showing blood vessel without invasive way. So our AI analyze and detect and predict future cardiovascular and kidney metabolic related diseases very precisely. So we have three secret sauce. We have three secret weapon. The first one is our data set. We have high quality and massive data set. We collected 2 million data set with like matched eye and cardiac CT and blood vessel data set. And second one is our clinical consensus. We were able to publish many prestigious journals and also then building clinical consensus among them like major conference like American Heart Association, etc. And the third one, we have already some strong clinical partners across the world, like the biggest hospitals in Europe side, Korea, and of course in the US, like Mayo Clinic. So those three secret weapons makes us special, and we believe we changed the paradigm of the cardiovascular kidney metabolic care.
Excellent. That's fantastic. And um, perfect. 30 seconds. Okay, next up is Prognosis, and tell us what you're doing with in sepsis.
Hi, yeah, nice to meet you. I'm Robin Carver. I'm the SVP of commercialization for Prognosis. We are a biology-based technology company that is redefining the standard of care for critical conditions. And we believe that healthcare shouldn't be a one-size-fits-all model, but instead our mission is to tailor healthcare to each patient's biology through the creation and delivery of integrated diagnostics and therapeutics. We work at the intersection of science and technology, studying the unique biological signatures that make each of us different and our reaction to infections different. And we have a biobank of over 130,000 biological specimens that crosses the healthcare continuum. And we study how patients change according to the things that we do to them while they're in the hospital. Our platform has enabled the development of an AI-based diagnostic called the Sepsis Immunoscore, which received FDA de novo authorization as the first ever sepsis AI diagnostic tool. And this platform is also enabling us to think past diagnostics. And in the next year, we'll be launching a clinical trial that will focus on an AI companion diagnostic with a therapeutic for this space, because sepsis and other conditions like it alter patient lives, and that paradigm can be changed with the right investment and the right focus in this
Great.
space.
Robin, thank you. That's excellent. Actually love what you guys are doing. Curion, Rick, I assume you're here. I've been following your company for a while, and tell us what's happening and how you're helping with the cancer.
Hi, thank you, Mark. Hey, this is Fan. I'm the COO of Acarian, standing in for Rick, our CEO. Rick and I have spent our careers at the intersection of science, technology, and patient care. And what's really driving us here is to close the gap between innovation and impact. And in oncology, as everybody knows, that gap is painfully clear. We have nearly 100 target therapies approved by FDA. However, fewer than 1 in 20 patients actually receive them. So the reason isn't lack of therapies. It is a bottleneck in testing. Biomarker testing today is too slow, too expensive, and too limited. At Acurian, we are applying AI to change that. What really made us unique is our combination of clinical rigor and operational simplicity. We have validated our test against gold standard genomic assays and show that we can outperform next-gen sequencing in accuracy and sensitivity. Yet it requires no additional tissue, shipping, or complex workflow. That makes us scalable, makes it possible for us to scale across labs worldwide. So for us, it's about bringing precision oncology to the point of diagnosis, helping clinicians act sooner, and giving patients the right treatment right away.
Great.
Thank you.
Thank you. Next up, and remember what we're doing here, everything is going to be edited. Going to keep it down to 30 seconds and tease out what it is. What is it? What makes you different? What makes you crazy great? Bunker Hill Health. I love what you're doing. It's probably companies like you that forced Epic to really rethink their entire model. Let's hear it.
Hey everyone, my name is Nesh. I am the CEO and co-founder of Bunker Hill. We really started Bunker Hill to help folks like everyone on this call. In my past life, I was a researcher at Stanford working on building different AI algorithms for use cases in healthcare. We would build algorithms, publish, make bold claims about them, and they would never go anywhere. They would be sitting on my laptop collecting dust. And so we decided to do something about it. And what we do as a company is that we work with researchers across the world to help them get their innovations to market. In a one sentence summary, we are a platform for creating, sharing, and deploying AI agents in healthcare, both on the clinical as well as on the operational side. And today we work with hundreds of hospitals and are getting a new FDA clearance every other month at this point. Thanks.
That's awesome. That's perfect. Perfect example of a great partner for all you guys. All right, up next is Avo, and talk about again how you're grabbing the HR data and the notes and making it so that everyone can understand it.
Thanks, Mark. I'm Lawrence Coleman, co-founder of Avo. Avo is building the platform for clinical copilots in the EHR. And our technology is powered by a copilot builder, meaning new copilots can be built in 15 days. We provide off-the-shelf copilots or the ability for hospitals to build their own. Our latest copilot was developed alongside MCG Health, which helps infuse discharge criteria into clinical workflows to reduce length of stay and enhance clinician efficiency. Our platform has been shown to improve clinical outcomes, save clinicians up to 87% of their time in their workflow, and reduce millions of dollars of costs for our partners. And in the era of AI, things are moving so fast that companies and hospitals really need the ability to innovate and iterate at the point of care quickly. And that's what our Copilot platform is designed to do. It future-proofs our customers by giving them the ability to deploy copilots for unlimited use cases and needs, and for things that they know they need today, and for things that they might not even know they need tomorrow. Thanks.
Perfect. Next up is Huron AI. I loved your UCSF story, so I hope you're going to share it with us all.
Yeah, thank you so much. My name is Kingsley. I'm the founder of Huron AI. Think about Huron as an extension of the hospital when a cancer patient is diagnosed with cancer. We know that they need a lot of things for better healthcare outcomes. They need to address their social needs. They need to address their clinical needs. So things like side effects. They need to address things like transportation. So we have an orchestration layer of several AI agents that help match patients to resources like transportation, prescription assistance, help them navigate their symptoms and side effects, and we free time for the healthcare system. So we essentially augment social workers, care navigators, and bring measurable ROI to these hospitals. We have exclusive data sharing agreements with places like Mayo Clinic, Johns Hopkins, and Mark, as you mentioned, in UCSF, we showed that we were able to reduce 80% of in-basket messages. These are mundane, nurses are answering the same questions all the time. But with Hurona, with just natural language, patients can talk to Hurona and get all these answers. Just think about it as the patient's best buddy that is in their pockets. They can access it anytime that they want. And we're really excited about our traction and growing to be that future of healthcare outside the hospital, where it matches the workflow of the hospitals and the healthcare systems, and we bring them measurable ROI and save the patient cost and get them better outcomes. Thank you.
That's great. The story is amazing. If you could basically, your story of cutting down doctor messages by 80%. I mean, all my physician friends, that's complaint number one. They have no life, right? They're being messaged there, 24/7. Okay, so we have actually just finished our first group here in AI and patient care, and we'd love you guys to hang out and listen to hear what's going on in AI health operations. Again, these are companies that you're going to want to work with. These are what you're going to hear about. But we're going to move over to AI and health operations right now. And right here, you can see the company list. We're going to start with the best of class companies. And we'll start with Rad AI.
Thanks, Mark. I'm Dimitri Aniakopoulos, the Chief Innovation Officer at Rad AI. Nearly every care decision relies on a radiology report. It's the blueprint for diagnosis and treatment. But creating those reports is one of the most time-intensive parts of medicine because literally every single word matters. Accuracy and clarity directly shape that patient experience. Rad AI uses AI to ambiently generate the report, personalized to each radiologist's voice and workflow, bring the humanity back to that communication. It saves time per shift, it reduces report errors by 64%, and is already trusted by more than half of the US healthcare system, including Mayo Clinic, Cleveland Clinic, and Sutter Health, as well as 9 of the 10 largest radiology practices. And just this morning, we put out a press release with the first of its kind partnership with RSNA, the Radiological Society of North America, bringing over 100 years of radiology expertise and knowledge directly into that workflow. Ultimately, if you make the radiologist faster, you sharpen the entire healthcare experience for the patient, and you make it a much more integrated whole that they're able to run through.
Yeah, no, we've been following you guys closely for years, and the story is coming together so nicely. Congrats. Next up, and company you probably have number of you heard of is Cohere Health, and we're going to hear about what they're doing in prior auth and faster care approvals.
Hi, I'm Jill Dornan from Cohere Health. It's great to be here and really exciting to hear these stories today. We are a clinical intelligence company that started in a not so popular part of healthcare, prior authorization, and really our goal was to use AI and get to a faster yes. So we're driving automation, we're driving greater transparency, and what we're doing today is auto-approving up to 90% of prior auth requests. And that other 10%, what we're doing is using AI to help empower clinicians to operate at their top of their license to make that part of the process more efficient. And we've been able to do that working with payers and providers and achieving a 94% provider satisfaction rating that we're quite proud of. The use of AI is in healthcare does require responsibility, and we take that seriously. We're committed to making it safe, transparent, and auditable, and always clinician reviewed. So we have about 450 models that were developed by our data scientists in partnership with the 150 clinicians that we have on staff to make sure that we are taking the latest and greatest medical insights and best practices to bring to bear on prior auth. And now that we've tackled that, we're actually bringing those pre-care insights to payment integrity to help providers actually get paid accurately and more quickly. So really, we're proud of the fact that we've been able to take that very manual and painful part of healthcare and make it a little bit better for everybody.
Excellent. Thank you, Jill. Next up is Zolas, and we're going to hear about your objective scoring model.
Yeah, hi, my name is Tim Kosser. I'm the Chief Revenue Officer at Exolis. What we do is we help providers make more effective and efficient decisions related to medical necessity, which in turn streamlines the utilization review and case management processes. We do this by ingesting data that already exists related to the patient's episode of care and medical history. We then apply our AI machine learning capabilities based on our over 10 years of history and over 300 million patient encounters. One of the most exciting things that we do at Exolis is we've intentionally designed this platform and process to be extensible to payers. So by incorporating the payer into the process in a more proactive manner, we have the ability to prevent denials before they already exist. And so this shared framework of data and AI will further reduce the friction and administrative waste that is a problem within healthcare today. Thank you.
That's short and sweet. I love it. Thank you, Tim. The final candidate is Lintas. Lintas could not join us today. They're having typically sometimes what happens with companies, there's an announcement, something else going on, and they have to basically stay quiet. But we wish them the best of luck. So those are the 4 companies: Rad AI, Cohere Health, Exolis, and Lintas that are best of class in health operations. All super scale companies that are scaling, really making a difference, and we're excited about it. We're going to now go to the rising stars. So the rising stars in health operations, and we're going to hear 8 great stories. We're going to start first with Lucem with Health Reveal, and tell us what you got.
Hi, everybody. I'm Sean Cassidy. I'm the CEO and co-founder of Lucem Health. We started the company with Mayo Clinic to tackle one of the biggest problems that all of us face now and will face in the future, which is the problem of undiagnosed disease. We help healthcare provider organizations build and deliver effective, scalable programs for accelerating detection of undiagnosed disease. We offer a unique commercial model with partners that actually allows us to deploy our solutions at most provider organizations at little to no out-of-pocket cost. That's Lusum Health.
And I loved your video where you said $1 spent is $7 saved. You know, that was so if you want to watch a great little video, Sean, it's yours. You got you top ticked.
Appreciate that, Mark.
Next up is Humata Health, and we'll talk about what you guys are doing in prior auth.
Greetings, friends. My name is Jeremy. I'm founder and head bottle washer here at Humata. I spent 20 years, I describe myself as a recovering radiologist. Spent 20 years at this little clinic in Rochester, Minnesota, where I learned two things. Number one, put the needs of the patient first. Number two, no money, no mission. And so we are a one-trick pony trying to solve this problem that everybody hates in healthcare: prior authorization. Every year, over 300 million patients wait for care because of this administrative burden, and we're on a mission to solve this, as we like to say, on both sides of the fax machine. We say we're built for yes. To solve this problem, you have to solve two really important pieces of the puzzle. Number one, there's this interoperability challenge to get information between providers and payers. And then number two, you need the experience and the data models to build the artificial intelligence to actually get to yes. And so what we're proud of is, having done tens of millions of these, we understand the information that needs to flow between the two parties to get to yes, and are super proud to not only handle this on the medical benefit, but now also starting to do this for specialty pharmacy as well, which every one of our health systems and payers care a ton about. So we are built for yes, and we are solving prior authorization.
Love it. Thank you, Jeremy. Perfect. Next up was SkyPoint Cloud. They actually have a similar type of conflict, so they're going to pass. So we're going to go right to Escher Health. And Escher, I love what you guys are doing, and tell me about how your AI is basically helping people find those right codes and right programs.
Yeah, thanks. My name is Pedram Afshar. I'm the founder of Escher Health. The company actually started out as a pretty painful and personal story for me. I was on rotation in the ED when a patient was diagnosed with cancer and didn't have insurance. I walked her down to the financial office to help her through this process because of the urgency, and what I saw was appalling. Long wait times, manual processes, poor explanations, and very sadly, she died of her disease, and that left a really big impact on me, and I knew I had to solve this problem. So there are 80 million people of our most vulnerable neighbors who need to navigate this antiquated Medicaid and government insurance program enrollment every single year. But beyond those 80 million, inefficient processes affect every one of us through increased healthcare costs. So it's really a national problem. What Escher Health is trying to do is bring down the cost of enrollment for the whole population to as close to zero as possible. And this is beyond, you mentioned Epic, beyond Epic's approach of sending individual patients a single digital form one at a time. Rather, we help the hospitals with their population of uninsured patients by giving them a very usable AI-enabled self-service lane. So our tools sit at the middle of talking to the EHR, talking to the government, and talking to the patient. And this means that the staff reduce their time of having to work on applications from 1 hour down to 10 minutes. And we should win, not just because we're bringing technology to Medicaid and government enrollment, but because we're creating a new type of job. It's the new human financial counselor who's able to work with their AI counterparts effectively. We've enrolled 50,000 patients across the US and increased provider revenue by $12 to $15 million in the first year of use. And that's attributable to Escher Health's increased efficiency. But truly, my North Star, and I'm not just saying this, is remembering that patient of mine who died in the ED who may have been alive today if our technology was available for her.
Excellent. John, this perfect. Great job. Intelligent, you guys are up next, and let's talk about what you guys are doing with unstructured clinical notes.
Yeah, thanks everybody. So I'm Kim Perry. I'm the Chief Growth Officer of Intelligent, and what we do is we put healthcare data to work. This industry is data rich, but insight poor. So what we do is we're an AI powered solution that exclusively focuses on all of that unstructured data and medical records. So we do two things. We do high quality data extraction at scale, and we also do AI assisted chart review. And our tooling and solutions enable many different use cases in healthcare, whether it be with the pharmaceutical or life sciences industry on drug discovery and clinical trial matching and monitoring, or real world evidence. We work with payers on prior authorization and their risk models, payment integrity use cases, care management, as well as the health systems in general analytics, rev cycle, research, and just care team burnout in general.
Thank you. Thank you, Kim. That's great. Next up, I want to rapid claims. Let's talk about how you guys are keeping the money flowing.
Hi, everyone. My name is Abhinay. I'm one of the founders at Rapid Claims. We are a mid-revenue cycle setup, but our goal is to basically make sure that providers can treat patients well. So when we work on that piece, we do documentation improvement, make sure that the provider is treating that patient and documenting it well. We do autonomous coding with 98% and higher accuracy to make sure that there's less burden on revenue cycle personnel. And then we also do scrubbing and denial management. So we do mid to end revenue cycle with a lot of focus on helping these providers treat patients better. So we have started working into prior auth and a lot of other setups, but our goal is to make sure that the revenue is optimized and make sure that the denials are reduced and providers start working with patients better.
Perfect. That's great. Sohar Health, talk about patient validation, what you guys are doing with providers, and it's an exciting story.
Well, that's really kind, Mark. Thanks so much. I'm Dr. Ash Mandavia, CEO, co-founder of Sohar Health. I share in a lot of the pain points and feelings that resonate with peers here, especially if you've been on the clinical coalface and you've seen the challenges patients face. I guess I also stand here as a naive European, pulling at a thread of huge complexity in the healthcare insurance space in the US, and it does often make my mind boggle. But I think that's why our team is kind of crazy enough to tackle this problem. We built an AI-powered front-end RCM platform that cuts insurance complexities from 20 minutes in the patient intake flow down to 20 seconds. Our technology powers leading providers in the US and care navigation platforms, including the likes of ZocDoc, Talkiatry, Ruler, BetterHelp, and Cerebral, processing tens of millions of API transactions every year. We automate everything from insurance discovery, verification of benefits, network status determination, and cost estimate, things that are so error prone for manual operations teams during the intake flow and super time consuming. The results are proven: up to 95% of auditable accuracy across payer benefits checks, 18% higher patient conversion, 90% lower operating costs, thousands of hours of manual work saved each week, and ultimately an 8-to-1 ROI over 12 months. Think of it like the Amazonification for access of care, making insurance invisible so patients move from intent to appointment instantly so that providers can focus on delivering care, not managing those complexities.
Perfect.
Thanks.
Great. That's great. Next and last is Seifa, and I love what you guys are doing for pharmacists. It's different type of use case, and I think everyone's going to love to hear it.
Yeah, thank you so much. Nice to meet you all. I'm Eunice. I'm co-founder and CEO at Asefa. I'm also a pharmacist by training. With Asefa, we create AI agents that automate all of the manual workflows for pharmacists so they can work more on clinical care. Right now, there's an aging population. There's already a limited number of pharmacists, and this will only get worse and worse, where we simply don't have enough human resources. Everyone kind of overlooks pharmacy. As you can see in this call, there's not really another pharmacy company. But the average patient sees a pharmacist 35 times, whereas they see their physician 4 times. And there's no point in writing a prescription for a patient if they don't receive it in a timely manner. So what we do is 2 of our main products. One of them is intelligent document processing. We have the highest accuracy document processing model that can actually process prescriptions autonomously. So not with human loop, just pure autonomously. And that allows pharmacists to just be verifying the prescription at the checking point before it gets to the prescription, the patient. This way we cut down the data entry time from around 2 to 7 minutes down to just 30 seconds. Another one of our tools is for calls and SMS to the patients. Right now, PBMs have call centers, patient hubs have call centers, pharmacies also have a lot of people in call centers as well. There's no point in having a lot of people in call centers for PBMs also talking to the ones in the pharmacy as well. So what we do is we put the agents into their software systems. We cut down the full-time employees in the call centers down to around 10%. And actually, most of the agents are able to speak to each other to automate some of the very tedious items, like, for example, PA status checks, scheduling for deliveries, identifying if a patient is ready for a refill, etc.
Thank you, Eunice. That's great. So we've now gone through all the companies, and we're at 12:50. We have 5 more minutes. I had a whole bunch of other questions, but I'm actually going to not ask them because I actually think you guys have done a great job. What we really wanted to do here is we wanted to get a crisper take on what you guys do and help the judges assess it. What's going to be important here, you've seen platform companies that are selling platforms that you could basically be, you guys should be licensing and or partnering with. You got companies selling solutions that are very nicely adjacent to what you're looking to sell. We're all coming together at HLTH and only in 2 weeks. You're going to meet each other. We're going to make it real easy. We're going to email introduce you to each other. Take advantage of that. This is like a really good opportunity that's coming up at HLTH. We're going to have this celebration party at the end. You're all going to be there as finalists. You're all going to be featured. You're all going to be wearing little, probably last year we had lays around people. I don't know if we're going to get the lays this year. We're thinking about it, but we'll have great stickers. You're going to want to meet each other. And a number of you are going to win, but honestly, you guys have all won. You've gone through, there have been 300-400 companies here, and you guys are what's left. Okay, so you should be super proud. You know how tough it is, what it is you're doing. This is it's a grueling, but such an incredible opportunity in the space, and you guys are the best of the best. So I'm going to give you the rest of your day, unless you have, any other questions. And I wanted to thank you all, and turn it back over to Bethany.
Yeah, thanks, Mark. Congrats to all of you. This is super exciting. Make sure you mark your calendars for Monday, October 20th, where we crown the winners live across 4 stages at Health in Las Vegas. There is a grand finale agenda on our website, and there's an add to calendar for each stage, and you'll find your AI stage. So if you want to add it to your calendar, it's super easy on the website. Don't forget to join us, like Mark said, at Chica at the Venetian from 6 to 9, where we toast to the winners and celebrate the entire digital health community. So again, thank you for joining. Congratulations on being finalists, and you all are doing great things. This was great to hear about. Thank you, everybody.
Kudos, guys. You guys are great.
Well done, everybody. Thanks,
Yeah,
everyone.
good job.
See you soon.
Thank you.
Thank you.
Have a good day, guys.
Thank you.